Pleased to be joined now in Mvskoke Media Studios with Mr. Roger Jenkins with Southwest Hospital Partners. Sir, thank you for being with us today here.
Thank you. Happy to be here.
Well, really, we just wanted to ask you about how you came to be partnering with the Mvskoke Creek Nation, specifically its Department of Health.
We were asked by Chief Floyd if we would be interested in helping the nation with the turnaround of the Department of Health. We were fortunate enough to be engaged and have been since the 1st of June. So we've been working through the assessment of the Department of Health, which has been completed, and now we'll turn towards moving the Department of Health forward.
Well, I guess the million-dollar question is, what did you find in your review? What are some of the things that you looked at and saw?
You know, the Department of Health has gone through a lot of trials and tribulations. It's had lots of leadership changes, and the hallmark of any great organization is stable and consistent leadership. And I think that's one thing that's been lacking with the department for quite some time. I think part of that led to some acquisitions that have been problematic for the department, but not catastrophic. So we're looking forward to working with them on developing an integrated delivery system, which will position the department well for the future.
When you say acquisitions, are you thinking that's the main, probably what we're looking at here, or is that just one of the larger?
It's multifactorial. The reality is the Department of Health has long been known as operating primary care clinics. They operate 7 of them in 6 different cities within the tribal jurisdiction, and they do a fine job of managing those enterprises. But they were asked to become a hospital company almost overnight. With only 1 hospital in their portfolio, they took on 3 more. And that's a big ask, that's a big jump for any company, and the lack of information systems and the lack of subject matter experts on their staff made it even more difficult. So it's been a big hill for them to climb, but fortunately they've weathered the storm, and it'll position them well for the future to have all those resources and facilities, but they've got to be set up in such a way that they're efficient and able to deliver what the citizens of the nation need.
Now, when you said that there was a lot of turnover in leadership, things like that, that can be applied to many different fields. Why specifically was it detrimental for the Creek Nation Department of Health?
Well, the interesting thing about the Creek Nation is that if you look at long-term planning, they don't have any. If you ask around what's the 5-year plan, nobody really has one. And that's usually a function of leadership, and that leadership starts with the board and goes all the way through the organization. And there wasn't really any evidence of that, and that's not unusual. We see that with a lot of our clients. But part of having a good map and knowing when you've arrived is knowing what the plan is. And that's something that we'll have to work on with them, is to make sure that we kind of know where we're going.
Right. You look at plan, I like that word that you said there, and then putting it in place. What do you suggest now? I mean, these are things, as you said, you've seen these things before. Are they fixable problems?
Absolutely. That's the good news, is that while you kind of wound up where you are by accident, the good thing is that you're in a good place as far as the future is concerned. If you look at what's going on nationally, you see a lot of discussion about population health management, and you see pioneer health organizations have been tried in 12 different locations around the country, and basically they're taking a population and they're serving all of their needs through one integrated delivery system. You all are already there. You already have a defined population, the citizens of the Mvskoke Creek Nation. And they already looked at the Department of Health for their health care. So you already have parts of it. Now you have the delivery system in which to deliver it. The system just has to learn how to work with all of its component parts. And that'll take a little doing, but the good news is you have all the parts. Now we just have to get them to work together properly.
So now that your review is complete, What is the process here? Do you report now to Principal Chief James Floyd, his office? What capacity?
I work with the Secretary of Health to kind of help them move the process along. Right now, as with every tribal enterprise, they're working on their budget cycle. So we've been spending a lot of time getting this next year's budget ready, so everybody knows how that's going to play out. So once that's done, then we'll begin to work on some more of the structural problems, such as productivity management and things like that, so that they can better manage the businesses that they have established.
Wonderful. Now, is there anything further that you'll be doing other than just reporting your findings to the chief?
We'll continue to work with them in developing systems and management tools, as well as developing the staff. You really don't have a lot of subject matter experts, especially on the hospital side of the operations, resident on the staff of the Department of Health. So we'll fill that gap while we continue to develop the talent of the folks that work at the Department of Health.
Wonderful. Now, you said about some of your other clients, you've seen some similar things. I wonder if you, in your capacity, have ever worked with tribal health systems other than the Mvskoke Creek Nation?
Yeah, we have actually had engagements prior to. My partner and I have both worked in other tribal enterprises as consultants. And my partner has worked as a line manager in another tribe. So, yeah, we do have experience with it. Most of our experience, though, is in the private sector and trying to work with not-for-profit and for-profit hospitals around the country.
Do you see any trends in tribal health, that things that they're having to deal with that are specific to their situations that may lead to things that come up?
Yeah, I mean, I think tribal health in general is undergoing some pretty significant changes. For years and years, tribal health was dominated by the IHS and programs that they outlined and the policies and processes that they had in place. But all tribes now are experiencing growth in what is usually referred to as third-party revenue. And that's because the nation's citizens are aging, so more of them are becoming Medicare beneficiaries, and that changes the makeup of the delivery system for healthcare. So it becomes less and less dependent on IHS and more dependent on third-party revenue streams. And that's a pretty big shift for an organization that's used to working in a different way.
Integrated delivery systems, could you explain that to people that may not know?
Sure. Integrated delivery systems are basically healthcare organizations that are able to deliver healthcare services across a wide spectrum of care. Generally speaking, inpatient care is one side of it and outpatient care is the other. So think of it as your doctor's office or a hospital, okay? But inpatient care also includes services like skilled nursing facilities, rehabilitation, inpatient rehabilitation, things like that. And then it also includes outpatient services like physical therapy, occupational therapy, as well as the doctor's office. Very few delivery systems can do all of it. So that's where the term integrated comes from, is that you have a delivery platform that can do all of those things. And that's one thing that the Mvskoke Creek Nation enjoys with its Department of Health, is it covers almost all of those platforms. We've got some gaps to fill, but the core parts are here, and that's the thing that's exciting and something to build on.
You give us a timeline of when your review and the actual process of your work here with Mvskoke Creek Nation will be complete?
I think it'll be several years. We have lots of things to do to make all of those component parts of the Department of Health work with each other, as well as help the Department of Health better manage the operations that they have and develop the talent that they need to be able to do it. So there's going to be a pretty long engagement, I suspect. If things go great, it's probably 1.5 to 2 years, but it could easily be 3.
Is there anything else that you would like to add, maybe that we've left out to this point?
The wonderful thing about this engagement is you've got a lot of great people trying to do the right thing for all the citizens of the nation. And while the Department of Health has had its struggles, it's certainly focused on delivering excellent patient care every single day. And that's something that we don't always see with clients, and we're happy to experience it here and quite thankful for it.
Mr. Roger Jenkins, Southwest Hospital Partners. Thank you so much, sir, for not only being with us today, but the work you're doing for the nation here.
Thank you very much.